Alrighty. I'm Sam. This is Nathan. I'm doing a trauma assessment. Alright, Nathan, what's happening?
You arrive to the scene of construction zone where a man is lying on the ground. He has fallen off a scaffolding and is 30 feet to the ground, lying in a pile of debris. He's lying on a supine with his head in neutral position, arms close to the side and legs close together. You may now begin.
Okay, PPE. Is the scene safe?
Yes.
Okay. Mechanism of injury, I believe, is a fall. I have one patient. I'm going to consider spine stabilization, have my partner hold the spine, the neck in line, and stabilize the neck. I'm going to move on and state my general impression. I have a patient who fell. Hello, sir. My name is Samuel with ambulance. Can you hear me? Can you hear me?
No response.
Okay, trap pinch.
No response.
No response. Okay. My patient is U on the AFU scale, unresponsive. So my patient's speech complaint is unresponsive and he has fallen. I'm going to begin. I'm going to move on to ABCs in a second. But do I see any major bleeding?
No major bleeding.
No major bleeding. Okay, I'm going to move on to my ABCs. I'm going to first check the airway. I'm going to look inside the mouth. Is the airway patent?
Airway patent.
Airway is patent. Okay. Does my patient have a gag reflex?
No. Yes. No.
No. Okay. I'm going to insert an OPA by measuring from the tip of the ear to the jaw, into the jaw. Insert that. I'm going to check my patient's chest rise and falls and make sure that it's adequate. It looks that it's equal. I'm going to listen to my patient and the different parts. Do I hear anything?
No.
Okay.
Decreased breath sounds on the left chest.
Decreased breath sounds on the left chest. Okay, I'm going to apply oxygen via a non-ring breather at 15 liters per minute. I'm going to have my other partner hold that. I'm going to move on to and check, make sure you have a pulse. Does my patient have a pulse?
Yes.
Patient has a pulse. Okay. I already said major bleeding. I believe the skin is warm and pink. Is that correct?
Cool, pale, and clammy.
Cool, pale, and clammy. Okay. I'm gonna do a capillary check on the fingers. Do this like 4 seconds. You're cooked. Yeah, and then I'm gonna move on to breathing. I'm gonna listen, and feel. Listen. Okay, I believe my patient's breath rate is 16. What is that?
It is 28.
28. Okay. I'm gonna once again assure proper ventilation. Is it good still?
Yes.
Okay. Now I'm gonna move on. I'm not gonna move on. I'm gonna have my partner do a set of vitals and attempt to obtain a sample history. I'm gonna move on with my secondary assessment. I'm gonna start at the head, checking for any deformities, any moving or of anything. I'm gonna look inside the ears for anything. Do I find anything?
Slight bleeding behind the ear.
Okay, I'm gonna add some gauze behind the ear and apply some pressure. Does that stop the bleeding?
Yes.
Okay, I'm gonna move on. I'm gonna check the eyes with a pen light. Do I see anything?
Equal pupils.
Equal pupils. Okay, I'm gonna move down. I'm gonna check the nose, jawline. I'm gonna look once again inside the mouth. Is it still patent?
Yes.
Okay. I'm gonna check the back of the neck where the spine is. Do I feel anything?
No.
Okay, I'm gonna move down to the neck and check and make sure the veins are good.
Veins are good.
Okay, I'm gonna check the trachea. Is that good?
Trachea, good.
Okay, I'm gonna move down to the chest. I'm gonna check the clavicles, shoulder bones, move down along the sides, and then I'm gonna feel on the sternum. I would normally first expose this and then do that. Do I feel anything while I'm doing that?
No.
Okay, then I'm gonna expose the abdomen, and I'm gonna begin look, listen, and feel. Obviously, I'm gonna begin to palpate the abdomen. Do I feel anything?
No.
Okay. Then I'm going to move on down to the lower extremity. Do I see any reason to check the genitalia?
No.
Okay, then I'm gonna press in and down. Sorry, this tickles. And then I'm gonna move down the leg. Do I? Is this good?
Yes.
Okay, it's good. Okay, moving down the leg. I'm gonna check. Well, first of all, normally I cut it off. But look, listen. I'm gonna go all the way down. I'm gonna check for a pulse. Do I have a pulse?
Yes.
Okay, sir. Can you move your feet for me? Okay, he's unconscious. We're gonna check the other leg. Move it down. Check the bones. Do I have a pulse?
No.
No
Yes.
pulse. Yes, pulse. Okay. Sir, can you move your feet for me?
Unresponsive.
He's still unresponsive. Okay. I'm gonna move up to the upper extremity. Start with the arm. Go all the way down. Check the pulse. Okay. Sir, can you squeeze your hand for me?
Unresponsive.
Bro, your hand is cold. Alrighty. Then I'm gonna move the other side. Go all the way down. Check the bones. The pulse. Okay, sir, can you squeeze your hand for me? Okay. Nothing is happening. Alrighty. Now I'm going to move on and log roll my patient. I would have my partner, we would before doing this, we would apply a C-collar. We're going to roll. I'm going to place my left hand on the hip, my right hand on the shoulder. I'm going to have my partner place here and here, and we're going to roll on the count of 3. 1, 2, 3. I'm going to do a blood sweep, check my, expose it, blood sweep. Check my glove for blood, and then I'm going to go down and check the spine all the way down. I'm going to palpate, make sure everything is good all the way down. Check all the way down to the coccyx. Check the back of the thighs and the buttocks area. The 1, 2, 3. I'm going to roll back. I'm going to roll this patient onto a backboard and immediately transport. And continue checking the patient every 5 minutes, and make sure that everything else is treated. Make sure that bandage on the ear is all bandaged up, and I'm going to give the report to the hospital when I arrive. Okay, and that's it.